Hey, it's Rebecca Mickey here and welcome to the 10-Minute Masterclass. In this masterclass, I'm going to be talking all about a dream feed and how it can help you and your child to get a better night's sleep. So let's get started. So what actually is a dream feed? A dream feed is when you get your child up whilst they're sleeping, you feed them, you burp them, and you lay them back down. Now the idea is that because you are feeding them earlier in the night, they're not then going to wake for a feed and will be able to sleep for a longer stretch. Most people are doing a dream feed then before they go to bed. So let's just, for example's sake, say that your child goes down to sleep at 8 o'clock and then you go down to bed at 11. Well, if your child is then waking at midnight, that means that you've had an hour's sleep before you've been woken. So let's see if we can actually introduce a dream feed here to help your child to get a longer stretch of sleep. And that then in turn means that you are getting a longer stretch of sleep before you're needed to go in and help your child again. Just before you're going to go down to bed, you want to go into your child and you want to pick them up and feed them and get as much of a feed into them as you possibly can. Now make sure that you burp them. This is not a step that we want to skip because we don't want them then waking uncomfortable shortly after. Then chances are they're going to be still asleep and you're going to lay them down. And then hopefully they should then be getting another long stretch of sleep, which means then that you are going to be able to go to bed and you are going to be able to get that long stretch of sleep as well before you're woken again. I think the perfect time to introduce this is at around 3 months of age. You can try before then, but oftentimes it doesn't work. But around 3 months is a really, really good time to do this. And as when we are working with anything sleep related, it doesn't just mean that it's going to work from night one. And so what I would do is give it at least 3 nights to decide whether it's going to work for your child or not. If you're nursing, you can most certainly try nursing your child at this time. But remember that oftentimes a child who's nursing is just going to fall asleep really, really quickly. It uses a lot of muscles. Sometimes people will have an easier time expressing some milk at another time of the day and then giving this dream feed with a bottle. This is something that's nice to do then with your partner, is that you can take it in turns then to do this dream feed. And it means that one of you can go to bed really, really early and then the other can stay up and do that dream feed. And so when it is potentially you're going to bed early, then you may be able to get a really long stretch then before you're woken up for that next feed. So it may be worth doing then if you are able to have your partner give a bottle at that time. A lot of times children who don't actually take a bottle at any point during the day do really well with a bottle at this dream feed because we are getting them up and they are still asleep. And so they may still just take that bottle, even if they will not entertain a bottle in any way during the day, they may certainly do for a dream feed. So as I mentioned earlier, you can introduce a dream feed at about 3 months old, but it doesn't mean you have to. It may be that it doesn't actually work for your child at that point. A lot of this does depend on how many feeds they get in during the day, whether they're just ready for this. We're looking at their temperament. We're looking at so many other things, whether you're going back to work or not. We're looking at a lot of things. That means that 3 months may not be quite ready for your child. So just if you try this and it doesn't work for your child at 3 months, don't worry. You could try again in a month or 2 months even, and see if it works for your child then. Don't just give up completely on the idea because it didn't work once. We want to try for at least 3 consecutive nights before deciding whether it's working for your family. And if it's not, give it a week, 2 or a month, and then try again. How do we get rid of that dream feed? Well, it's a good time is at around 8 months of age or after that you may want to consider getting rid of the dream feed. And I suggest that you do so really, really slowly, because if your child is used to getting a fairly big feed, then at that point, and you just cut that out, their tummy is going to be hungry and that is going to wake them because their stomach is used to getting that certain amount of milk at that time. The tummy is going to get ready to digest, and that's when they're going to start, their tummy is going to start rumbling, and that is going to wake them up. So what I suggest you do if you're wanting to work on reducing down the dream feed, either nursing or with a bottle, is to gradually reduce the amount that they get. So this is really easy to do with a bottle. You can see how many ounces they have and work on gradually reducing it down. Making changes every 3 or 4 nights works really, really well. So you may reduce down by half an ounce or an ounce, and what you're doing is you're helping your child's stomach to adjust the amount that they're getting, the amount that they're expecting. You also want to do a similar sort of thing if you are nursing. You can reduce down the amount of minutes that you are nursing. So if you're nursing for 10 minutes initially, you may nurse for 9, and then you can gradually work on reducing it down. Now remember, some children will need to feed during the night until they're around 12 months of age. That's completely biologically normal, and some children will most certainly go beyond 12 months of age. Again, that's completely normal for that to be the case. Don't worry, your child will make up for this milk if they need it. If they are needing this, hopefully they will begin to make up for what you're reducing down at night during the day. But if they don't, then they will continue to wake, and you may want to start up that dream feed again for a little while and then work on gradually reducing it down after you've settled into that. So let's just say your child obviously needs to have that feed at that time. They're still waking. You may fall back asleep after you've helped them, but if they wake again really quickly, then definitely hunger is an issue. And so I would just feed them. If your child is hungry, feed them. They're hungry, and so they want something to eat, and so help them with that. Then everybody is back to sleep so much quicker. And then just giving them those feeds for however long you're comfortable doing. When you then think that they're ready to try reducing it down again, then try reducing it down. You will probably naturally increase the amount that you're offering during the day. If not, that may be something that you want to be a little bit more aware of to make sure they're not missing out on any of that milk. Make sure that you click the link below, and you will be able to get the download, instantly get that download, which gives you all the information about the dream feed and reducing that down. And I will see you in the next 10-minute masterclass.